Have you ever worried that you may not fully recover from knee osteoarthritis or a knee injury and that you may end up in surgery or a knee replacement? Have you taken pain medication, Nurofen, or steroid medication to reduce the pain in your knee? Or have you pulled back from exercise, worried that you will injure your knee more? If you have, you're not alone. You're like me and a whole lot of other people, and this video is for you. I'm going to teach you exactly what you need to know to avoid knee surgery, to be able to reduce your pain without injuring your knee. And I'm also going to be teaching you the exact steps to follow to improve the health of your knee. My name is Martin Morris, and I have myself dealt with knee injuries and knee surgery. This is the information I wish I'd had that I didn't get from orthopedic surgeons, from the internet, and even myself, an owner of a medical clinic for 10 years, I didn't find this information. And this is the information that's going to help you and me avoid knee surgery and improve our knee health day by day. Firstly, I'm going to talk you through the options that will give you symptom relief only. But especially here, I'm going to teach you which are the ones you should avoid if you want to avoid knee surgery long term, because they have the potential to damage your knee cartilage, to damage your knee structure, and to move you in the direction of a knee surgery just because you took them to avoid pain. I'm also going to be sharing exactly what to do long term to build a healthier knee. I'm also going to be sharing at the end of this video the exact things that I did to avoid having to have a second knee surgery, and that have enabled me to have more strength and more confidence in my knee than I've ever had before. So let's get started. 3 important things. Mindset matters, combinations work better, and treatment must be personalized. Now, what do I mean by mindset matters? Did you know this? People who have these kind of thoughts, and I'm guilty of that myself. My knee pain is getting worse. My pain that I'm feeling means that I'm injuring my knee more. I'm probably not going to get better, and I might end up with knee surgery or a knee replacement. If you've had those sort of thoughts, it's normal, but people who regularly have these thoughts are likely to end up with a worse outcome. At least that's what this study said. In a study, people with higher levels of pain catastrophizing, that's what it's called when you're thinking negative thoughts about your pain and about your knee, had around a 70% lower chance of a good outcome than people who didn't pain catastrophize. This is not to say that your mindset changes the MRI. It means that your mindset can influence how your nervous system processes pain, how consistently you exercise, how well you stick to a treatment, and ultimately how well you recover. So your mindset is critically important. Your mindset determines, will you even give yourself the opportunity to try some of these options to reduce your pain and build a healthier knee? Or do you think that all is lost? If you're watching this video, then you're at least open to these possibilities. But here's another thing. Doctors also have their own mindset. Get this, I was watching a video on non-surgical knee treatment options, and this is what the surgeon said. Injecting steroids into a knee where the cartilage is all damaged already, well, that's arthritis, and it's probably worth it if you get some symptom relief. That's a person saying you're going to end up in knee surgery anyway, so why don't we give you a bit of relief? That's a mindset that doesn't serve you, because I can tell you that there are plenty of people who were quote unquote bone on bone that were able to be pain-free, that were able to get back their life, and were able to avoid surgery long term. That's why mindset matters. Here are the options that are going to give you symptom relief only. It's important to know this, because if you spend all your time on options that will only reduce symptoms temporarily, that means you're not investing on how to build a knee long term. But there is a place for these. Firstly, we want to avoid at all costs these high-risk options. These are the options that are going to damage your knee and move you towards knee surgery or knee replacement quicker. They are oral NSAIDs, so oral non-steroid anti-inflammatory drugs. Many people believe these drugs are pretty safe. Well, we know that they cause stomach ulcers and heart conditions and kidney problems, but Did you know that there was a study that found that people who used NSAIDs regularly were twice as likely to have more pain 2 years down the track, and they were 3 times more likely to end up in a knee replacement. Now, I'm not saying that these medications destroy the knee cartilage. There's no evidence of that. But what I am saying is the people who are relying on these for relief, especially long-term, were found to be more likely to have more pain down the track and to end up in knee surgery. This isn't an option that's going to lead you towards long-term having a healthier knee. Secondly, duloxetine, that's another medication that's been shown to be very effective to reduce pain. But here's the problem. It does produce dizziness, and there is a risk of falling. So now it is an option, but there's so many more options that can potentially give you pain relief as well, that why not explore them first? And thirdly, and the most dangerous, are the injected steroids. Now that's the one that the doctor was mentioning. Why not just give it to the patient if they've got knee degeneration anyway? It's only going to degenerate their knee a little bit more. But there are very conclusive studies that have shown that steroid injections to the knee destroy the knee cartilage faster, and they also damage the tendons. So if you're not going to use those, then what can you do instead? What can you try that will be free, easy, and no risk? These are a lot of the options that people skip over. The first one is probably something you have in your house already. It's ice. Ice is great because it's one of the most fast-acting pain relievers that exist. Also, heat. So putting a hot pack on your knee can be very therapeutic, can be very effective at reducing pain quickly. And the last one that everyone should be trying is gentle exercise. So if you're in a lot of pain, that exercise is going to be extremely gentle. It might just mean putting your knee off the edge of a table and just letting your calf swing back and forwards. It could mean getting onto a stationary bicycle and just going very, very gently and slowly. It could mean just some gentle walking around. That's what I'm talking about. But it's been shown to reduce pain significantly, often by up to 40%. And when you consider that some of these high-risk last resort pain medications only reduce pain by 40 to 70%, it means we're more than halfway there. The second group of options are cheap options. So they're no longer free, but they are still low risk. And so these should be the options that you're exploring. Low risk because they're not likely to cause any further damage to your knee. The first one is curcumin, and this is an amazing supplement made from the turmeric root. There are different strengths and different potencies. So if you're interested in more about that, drop a comment and I'll mention which are the most effective types. The next one is capsaicin. This is made from the chili plant, and you rub it on and it causes the pain sensors in your body to overload because of the chili and to cause significant and long-term pain relief, sometimes from 12 to 20 weeks. And it's very cheap and it's very safe. Topical NSAIDs, so non-steroid anti-inflammatory drugs, creams like diclofenac cream, have also been shown to be very effective without most of the side effects of oral NSAIDs. And then finally, Tylenol, paracetamol or acetaminophen, as it's also known. It's not shown to be very effective, but it's also safe when used within the specific limits. I hope you're getting tons of value from this video. A confession, this video has taken about a month to make sure it's the most up-to-date possible. So one way you can support my work is just by subscribing and liking this video. Much appreciated. Now let's get back to the video. Now, moving into more expensive but still low risk options, there are a brace. If your knee pain is caused by a knee misalignment and too much load on one area, can be very effective. Red light therapy is also shown to be very effective, but remember, the devices vary significantly. So just because it's red light therapy doesn't mean that it's always going to be effective. And then there is pulse emitting magnetic frequency devices. These are those beds that you can lie on. They've also been shown to be effective to reduce pain. And then I've got a category of don't even bother. Oral steroids, don't even bother. They're not worth it from a safety benefit profile whatsoever. Neither is aspirin or ultrasound. Now let's get into what is actually going to build a healthier knee. This is more important. So we're going to use symptom relief if we're going through a flare, if we make a mistake and we set ourselves back. because that will happen. But mostly we want to put our effort here, and it's totally possible that you can avoid long-term knee surgery if you do so. So I've broken it down into 3 steps. Step 1 is to decrease the load. By that, I mean your knee is under a load every time you walk, every time you do any exercise. If that load is too much for the knee, then the knee is not able to recover from that. Maybe it's playing intense sports, or it's to do with your job, you're carrying very heavy things all the time. I'm not saying stop doing those, but is there a way that you could modify your activity? Is there a way, not necessarily that you could do less, but you could do it differently? Because one of the worst things you can do is stop moving your body. But one of the best things you can do is identify these movements that are contributing to your pain and your knee degeneration, and just reduce those to the point that your knee can recover significantly. The second one is weight loss. This is for people who are carrying a few extra kilos, a few extra pounds. If you are carrying extra weight, then one of the quickest, simplest, and easiest ways that you can reduce knee pain and those knee symptoms is to reduce your weight. There are studies that have shown that for every 1 pound extra weight that you're carrying, 4 times more weight is put through the joint. The next thing, and this has been vital for me, is improving joint alignment. There are so many people out there whose primary reason that their knee is degenerating is because they have poor joint alignment. And I was a yoga teacher. I was focused on good posture, good alignment, and I was still guilty of this. I didn't pick it up until just a few years ago. But here's what happens. Basically, the joint, which is supposed to, this is your knee joint, move and distribute the weight through the whole joint. If there's knee misalignment, just distributes the weight in one corner, in one side. It's most common the inside part of the knee, what's called the medial section. And so people start to recurringly injure the meniscus on the inside. They start degenerating the cartilage on the inside of the knee, just that side. And they go to the doctor, and the doctor says, well, we're going to have to give you a partial knee replacement on the inside. If you could redistribute the weight back through the whole joint, you may be able to avoid knee pain and avoid a knee surgery forever. So there are techniques that can teach you how to do this. Everything from using the right orthotics to special postural classes. I used a method personally called the Egoscue method, and I also used targeted yoga and physical therapy to help me improve my joint alignment. It's a constant process, but it has yielded amazing results. And then finally, an anti-inflammatory diet is so important. If the causes of your inflammation in your knee pain is due to diet. So the things to watch for and the things to take out, firstly, I would say would be alcohol, sugars, refined sugars of all types, refined flours, so wheat flours especially. Gluten can be a trigger for a lot of people. Dairy products can also be a trigger for many people. Then there's pork and refined oil. So if that sounds like too much, just maybe try taking one out temporarily and seeing how you go. All of these steps that I just mentioned here are going to decrease the load. They're going to decrease the pressure that knee is under. The second thing we can do, and the second step, is to increase the capacity. If our knee had more capacity to deal with the load, the stresses, the foods that we're eating, then it wouldn't even matter that we were doing those things. So what can we do to increase the capacity of our knee? The most important thing, and this has been shown over and over, this is the number one thing that will improve your knee health, is exercise therapy. So a lot of people, when they feel that knee pain, the first inkling they have is to pull back. I'm going to do less. I'm going to give my knee a rest. I'm going to take it easy, and then I'll get back to things. This goes back to mindset. The mindset is saying that what I'm doing, the exercise that I'm doing to my knee is actually injuring my knee more. In most cases, this is not the case. While you may need to modify activity in itself, so physical activity, is one of the most healthy things that you can do. So exercise therapy is not just about doing any old exercise. It's doing those specific things that your body needs to get healthier and stronger and build a healthier knee. In my case, after I had knee surgery for a meniscus tear, I lost massive amounts of muscle on that side. When I measured the width of my thigh, it was 4 centimeters, almost 2 inches smaller than my right thigh. I was left after the knee surgery compensating with my right leg, which is going to lead my right leg to get injured and towards degeneration long time if I didn't correct it. So what I did was work strongly on building the strength of my left leg again and the size of my left leg. Today, it's even slightly bigger than my right leg. In your case, it may include aerobic exercise. It may include jumping exercises to build the resistance to your knee to impact, or certain exercises that build the tendon or the ligament strength so that your knee is more adaptable. You can turn, you can twist, you can play sport again. So this is the number one option to pursue. So next on the list would be what's called PRP, or platelet-rich plasma. This is a blood product from your own body. It's relatively cheap, and this has growth factors, healing factors, anti-inflammatory factors, and has been shown to increase the capacity of the knee for 6 to 12 months. It can be very beneficial. The next one is called Shockwave therapy. These are devices that you put on the outside of your knee in a clinical setting, and it makes this clicking kind of slight impact. It's like hitting the knee with something very, very gentle but impactful. And what this has shown is to do very similar things to PRP, to increase growth factors, reduce inflammation, and there are even some preliminary studies to show that it could even cause some regeneration. The next one is hyaluronic acid, or this is also called viscosupplementation. Hyaluronic acid is a natural acid that is found in your knee and in your skin that absorbs impact and helps maintain a healthy knee environment. As the knee degenerates, as that space between the knee reduces, this hyaluronic acid also reduces, and so you can get injections of this which actually help cartilage cells produce more hyaluronic acid themselves, and can also give some significant benefit for 6 to 12 months. And then there are supplements, so things that you can take. I'll give you a list here because these supplements are probably not what you're thinking. A lot of the most marketed supplements are not the most effective. So in order of effectiveness, chondroitin sulfate should be your first option, followed by glucosamine sulfate, and then avocado soybean unsaponifiables, or ASU. After that come fish oil and collagen peptides. In my experience, the first thing I thought of for knee health was collagen peptides, but it really comes about 4th or 5th on the list of effectiveness to improve the overall joint health. And then step 3 would be regenerate. This is still a questionable process. Is it really possible to regenerate knee cartilage? But from the studies that I've read, this is now undeniable that at least in some cases, knee regeneration, cartilage regeneration is possible. And the techniques that are used for that are normally stem cells. There are 3 different types of stem cells ranging in potency and also simplicity. They range from bone marrow aspirate, which is probably the lowest in potency, but the easiest to obtain. You can obtain it from yourself, from your own bone marrow. The next one, it's very similar, but there are more stem cells in it as what's called stromal vascular fraction. These are stem cells that are extracted from your fat cells. The stromal fraction has about 10 times more stem cells in it than the bone marrow aspirate. And then finally, there's umbilical cord stem cells. And the benefit of these stem cells is that they can be much more numerous and also more potent because they come from a newborn baby's umbilical cord rather than from your own stem cells, which may be 40 years old, 50 years old, 60 years old, etc. These have been shown to regenerate knees significantly. I also want to mention that I looked at these other therapies. One is called TENS. These are little devices that go patches on your skin and give it electric shocks. Another one is massage therapy. Another one is acupuncture. And then this one, which I saw on the internet, I saw a lot of people questioning whether this was a good option. It's low-dose radiation therapy, where a low dose of radiation is put into the knee and has been shown to reduce inflammation. I didn't include any of those because I didn't believe that they were as effective from the research as the things that I did focus on. For example, the low-dose radiation therapy, while it is considered low dose, the dose is still about 10,000 times higher than a chest x-ray. So it's a significant amount of radiation. And given all the other options that are available, I definitely would explore these ones first. So in conclusion, remember, mindset matters. It's so important. Your thoughts as to whether you can get better, whether you will get better, whether it's worth trying. Combinations work better. Ice, heat, gentle exercise. Each one of these might get you 10 to 30% improvement. But if you combine them together, maybe you combine gentle exercise with curcumin. You combine gentle exercise with ice, curcumin, and red light therapy. Each of them stack on and can build a greater pain relief. So it's often easy, or possible at least, to get equivalent or greater pain relief to these last resort high-risk options. Finally, treatments must be personalized. So depending on your personal situation, each one of these steps that I mentioned, step 1, step 2, and step 3, are likely to give more or less improvement based on whether this is the cause of your knee pain. With that, let me share what I did to avoid knee surgery the second time round. The first thing that was so important was mindset matters. When I injured myself the second time, I had a bucket handle tear on my same meniscus that I'd had surgery before. My first thoughts were, I'm a failure. The surgery was a failure. Nothing is going to help me. I'm going to end up in knee surgery. And I got into this catastrophizing, which leads to dramatically lower outcomes. So the first thing I had to do was stop that. And I used some techniques that I developed that I'll share with you in another video. If you're interested, just drop that in a comment and I'll make a video on that one. But basically, I had to replace those thoughts with positive thoughts of gratitude and appreciation and trust, and then visualize myself getting better. The second thing I did was to focus on knee alignment. That was critical. That was the piece that was missing for me, because all my life, I now realize that I have had a body that's slightly misaligned. My knees face in. That's what's called valgus knees. I have one shoulder that's lower than the other. I have one hip that's kind of further than the other. And when you don't have enough capacity, and this happens over time, that our regenerative capacity, our ability to absorb the day-to-day stresses through our knee goes down, either whether it's through age or whether it's through diet or whether it's through other things. This joint alignment becomes more and more critical, and it can become more and more detrimental if we don't deal with it. So that was the second piece. And then the next piece was this exercise therapy. This wasn't about just going to the local physical therapy clinic. I did all that. That didn't work for me. I also went to sports medicine doctors, did the exercises that they recommended. That didn't work for me either. I had to find specific techniques that were effective for knee rehabilitation. And I must say it was amazing. I can also share with you in a video what I did exactly. Let me know again in the comments. And then I used PRP, and I will also be using stem cells in the future. Not because my knee is dramatically degenerated. It's not. A lot of these regenerative techniques can be used to maintain your knee health for long term. It's easier to keep your knee healthy than it is to wait till it degenerates to stage 3, stage 4, and then look at how to reverse that. If you're interested in exploring what are stem cells, whether they could be useful in your specific situation long term, then I've created a complete video which will take you from knowing nothing to knowing everything you need to know to make a decision, to decide if this is something you want to pursue. That video is here, and I suggest you watch it next. See you soon.